Gracias, Mariana. Thank you very much, Mariana. Thank you also to Dr. Martinez, Bianchi. It is a pleasure, es un placer el poder hablar con ustedes hoy de algo que es muy allegado a mi corazón, to talk to you about something that's very close to my heart, and that is basically caring for the underserved of the community that we choose to live in. So thank you for the opportunity to be with you today. So I will start sharing here. Let's see if I can do this correctly. Can you see this? Yes, very good. So the name of the organization, as Maria mentioned, is Community Care Center for Forsyth County. Who are we? Basically, we are a nonprofit 501c3 volunteer-based medical clinic providing free healthcare services and medications to the uninsured and underserved individuals of 3 counties, Forsyth, Stokes, and Davie. Our mission is basically to provide compassionate, high-quality healthcare services to uninsured and underserved individuals in our community. Our vision is for every person deserves high-quality healthcare delivered with compassion, sensitivity, and respect. So here I have a summary basically of who we are and what we do on an annual basis. To start with, we are a member of the North Carolina Association of Free and Charitable Care Clinics. Those basically 70 different clinics throughout the state of North Carolina who are basically only in association through this one organization, who also has a national representation. And specific, again, we service Forsyth mainly, and we extend ourselves to Davie and Stokes County. We basically have, as we are representative of 2,000 different individuals who call us their medical home. We basically have provided in 2004, these are numbers for 2024. We have done 33,000 patient encounters, and that is inclusive of provider services, meaning physicians, nurse practitioners, physician assistants, dentists, etc., as well as lab work, x-rays, radiology, and so on and so forth. So not just providers themselves. Basically had 12,500 medical visits last year, and 2,708 mental health visits. And as I mentioned, 811 dental visits as well. The dental is both dentists as well as hygienist oral care. As it said at the start, we are volunteer based. We have about 327 volunteers. And of those 327, 59 volunteers are providers. In other words, again, physicians, dentists, and nurse practitioners, physician assistants. And so basically collectively around 13,000 hours of volunteers time that is given to our patients. The work that we do, that our providers do, and all that we do for them represents to the 2 hospital systems that are in the Forsyth, Winston-Salem area, about an $11 million, $3 million in hospital diversion savings. That is calculated via the North Carolina Healthcare Association in collaboration with other agencies as to what these services that we provide represent in diversions to emergency departments and other services that are sought out at the hospitals. Pretty much every dollar is basically representing a $6.39 and healthcare savings that are being done in our community. Next, basically, is I will tell you that, as I mentioned, is a multi-specialty primary care, multi-specialty clinic. And these are, what you see here is a list of all the different specialties that we provide. Of note, we just added hematology within the past couple of months. Towards the end of last year, we added pediatrics. We were not taking care of kids, but now we are. And as a result of that, we saw a need for psychiatry and for children's psychiatry in specific. So we have also added that just recently. Another big note is endocrinology, and this is one that we added last year. And bringing this one endocrinologist to our medical staff, we have reduced the A1Cs by half of all of those patients that were already getting care here. So tremendous improvement for the patients that we provide. Some of this is done as an affiliation, and I will show you in a minute our different affiliations that we have. But in affiliation with Wake Forest University, as well as other universities in the area. But in specific to Wake Forest, we have the residency program for internal medicine as well as dermatology that rotate here in our clinic. So outside of that, our services are very limited, but certainly enough to be able to provide these different services on site. Those that we don't, we have an affiliation or agreement with both with Atrium, Wake Forest Baptist, and Novant Health to provide us with the additional services that we may not currently provide. But as you can tell, as for example, x-rays and the reading of the x-rays, that's done through the radiology group at Wake Forest Baptist Hospital. And then the mammographies are done in collaboration with the Novant Health, where they bring their bus to our clinic, and we are able to provide those services as well. Medications are provided as we go through the process of helping the patient with a screening for patient assistance program, where they then can qualify to receive free medications from the different agencies that we associate with. So any of our patients that require, as I alluded to, require any additional services that we don't provide, any specialties that we don't provide, if the patient, for example, needs surgery or so, in our affiliation with both health systems, the patients are referred through a third party that is organized and run by the two health systems. And our patients are able to get that additional service, with the agreement that as part of our free and charitable care, that they will not be billed for their services. So the hours of operations, we work only Monday, and I say only, but in reality it's more than this. Mondays and Thursdays, we're open 9 a.m. to 8:30 p.m. and Tuesdays and Wednesdays, we're open 9 a.m. to 5:30 p.m. We're not open regularly on a Friday or Saturday. However, when we get a dentist, as for example, to volunteer, and the only day that they can give us is a Friday or Saturday, we open for that specific service. So those are things that we do, again, in making sure that there's access to care for the patient population that we're caring for. As I mentioned, of the different affiliations partners, these are some of them. This is not a comprehensive list, but certainly from academia, as I have already mentioned, Atrium Wake Forest University, School of Medicine, I'm sorry, that's a typo there. It's Forsyth not community college. High Point University, that's actually in progress right now. We are entering into an agreement with High Point University to become a site for their School of Dentistry rotation of dentist students. Then we also have Winston-Salem State University, where we have rotation for their nurse practitioner program, as well as the physical therapy, occupational therapy program. Novant Health basically is one that is very generous to us, very helpful to us. The facility that we are in is owned by Novant, and they lease it to us for $1 a year. And they also provide us with financial support throughout the year. And then some of the churches that have been very generous and caring for us to be able to care for the patient population. I'm not going to go through the list of other institutions, organizations that support us, but these are some of those that we count as partners and friends in the community itself. That's basically is my presentation. I would like to be more of communication dialogue with you about all that we do and how we do things. If you have any questions, I'll be more than glad to answer.